And moving forward, I am happy to invite Ms. Sarah Lascano from the USA. She's an internationally recognized mind-body expert and a master energy medicine practitioner. She is the founder of the Raisin Energy and the creator of the Raisin Lightwork technique. Sarah's expertise has been featured widely in podcast, radio, and print media. Sarah is also the author of the upcoming book, The Hidden Force Within, to be published this year, or maybe it has been already published. It's an honor to have Ms. Sarah Lascano with us today. Good morning to USA, madam.
Good morning. Good afternoon to you as well. Yes, thank you. I'm so pleased to be here. Take a moment to extend gratitude to the organizers of this wonderful conference and the mission of this conference. It's so important that we gather and talk about how we can improve the healthcare of the world. So this is such a wonderful, I'm honored to be here. I'd like to speak today about transforming patient outcomes and the role that biofield therapy has in integrating with our healthcare.
Yes.
I do routinely work with doctors, both MDs, naturopathic doctors, as well as holistic doctors, to address the gap in our medical care in mind, body, energy, and the biofield. When we incorporate these factors, we find that people get better from things that are not responding to treatment of all kinds. And so this gap is important that we focus upon it. I'd like to take just a moment and talk about some of the successes that we've had in the USA in integrative and holistic care. It is a massive industry that is growing and projected to continue to grow at a 23% growth. 72% of hospitals offer some type of integrative care. That might be meditation, it might be Reiki energy work, it might be offering an acupuncture clinic. This is really an amazing number. We obviously want to grow this number and increase the energy that is given to these centers. Sometimes they are quite small, but this is a wonderful number. I think it's a sign of change. Many people in the United States, consumers, are seeking out integrative treatments. And this number is growing up from 19% in 2002 to 36% in 2022 and is expected to continue to grow. Meditation and yoga are widely accepted and are, of course, amazing ways to calm the nervous system and improve receptivity to all types of treatment. And even physiological self-help. People are seeking out ways to improve their health. Continuous glucose monitoring is a absolutely booming industry, and even people in their 20s are seeking out, young adults are seeking out this information to try to optimize their health. Drip bars, which are IV therapy, non-prescription IV therapy, are becoming common as well. So there's a real opportunity for providing tools that people can use to boost their healthcare. They are hungry for this information. What I'd like to talk to you today about is some principles of quantum biofield therapy and how we can integrate this into our medical care. We know, the medical system knows that we have an energy system. It's just not trained in our medical training. We've measured the health of the energy system through EKGs for over 100 years. The EEG is measuring the energy system of the brain. Nerve conduction studies are measuring the energy flowing through the nervous system. So it's well acknowledged that we have an energy system and a biofield. Our medical system just doesn't know how to work with it. We can actually use therapeutic frequencies to influence this, which of course has not been very measurable, but the technology is catching up. We now have some quantitative ways to measure the subtle energy in the body, and I think that is going to help our medical system understand the opportunity. At least in the United States, our Western medicine system does not have the time. The doctors do not have time. They are not taught. They don't have the knowledge of the impact of the biofield on health and healing. And they don't have tools, most importantly. So without these resources and with only a 15-minute appointment to address all aspects of care, there's really not a way in the current medical system for doctors to deliver this healing. We know about the mind-body energy link in the medical literature. We have the Kaiser study that proves that traumatic experiences, stress, and experiences in early life lead to the leading causes of death later in life, and that was actually correlated. The more exposure, the more risk. We know of the widowhood effect and the broken heart syndrome, which also prove the importance and the acute impact of the energy field, the mind, the body on our physical health, even to cause death. So we know that this is important. There is much research that proves these links between our physiology and our mind, our body, and our energy state. There's obviously much more than just this, but this is just a sample. So we know that the body stores energy that disrupts its function. We know that experiences earlier in our lives can impact our physiology. Trauma, belief systems that have been accumulated, periods of significant stress, any kind of stress, physical stress, infections, injuries, surgeries, accidents, mental stress, overload of work stress. We know that has a direct link with cardiovascular disease and more. Emotional stress, and then infections, toxins, injuries. All of these exposures can be stored in the body and affect the body's energy that then can impact our ability to respond to therapies. And the mechanism for this is really that we are disrupting the body's ability to heal by all of this disruption that is stored that the body must work around. So we typically have an overloaded immune system, a nervous system that cannot downregulate, an endocrine system that is out of balance, and all of this leads to an increased likelihood of disease and a decreased ability for the body to respond to the treatments that are pursued, whether they're holistic or medical. So if we are able to free this stored energy, we can bring healing to the body. And biofield therapy is an amazing way to do that. It has been proven in the medical literature to improve outcomes, to extend life expectancies. And it can be delivered both through in-person means, but also distance. And that the distance piece is what I am passionate about, because I believe we can equip ourselves with tools that make a big difference, that are accessible and low cost. And that is the digital piece, which I'm excited to share. Now, the biofield therapy integrates and complements medical care. That's the other major benefit. There is no conflict. It does not replace medical care or holistic care of any kind. It really it strengthens the body organically at the foundation. We are improving the body's ability to respond and to heal. And so it's really integrative and complementary to all other therapies. There is no side effect, there are no interactions, even with other energetic healing means such as acupuncture. And we're really looking at improving the response by calming the immune and nervous systems. This is one of the primary mechanisms. By improving communication within the body, by reducing inflammation, normalizing that HPA axis and the body's stress response, by improving emotional and mental well-being, by decreasing past traumas, by neutralizing their effect. And all of this without having to relive, without years of therapy, can be done quickly and easily. Some of these tools also allow a patient to help themselves, which can also be very empowering when you're going through a major health crisis. And then, of course, as our energy is shifted, as our nervous system calms, we are able to better follow prescriptive care, whether that be a lifestyle change that we need to make or whether that be some sort of therapy. There are many types of energy blocks. Due to our limited time, we'll go through these at a high level, but I just want to highlight some. There is generational trauma that can travel through our families, and there's some really exciting research showing that this has been measurable. For instance, survivors of the Holocaust two or three generations down have shown methylation abnormalities that can be traced to that exposure. So we know that generational trauma plays a role, and biofield therapy is a way to negate or neutralize the effect of this within our body and within our epigenome. Our childhood exposures, we talked about those childhood ACEs in the Kaiser study has been proven, but this is absolutely a well-known fact, but we can neutralize the impact of these exposures on the physiology. We can actually remove the blocked energy that is activated and neutralize the impact on the immune and nervous systems, the cardiovascular system, all body systems, really. Childhood environment really matters. We absorb thought patterns, how we view the world, how we express our emotions, our ability to navigate stress and our resilience. If we are hypervigilant, all of this is determined by our childhood exposure. This is something else that we can neutralize and improve through biofield therapy. And past injuries and illnesses can leave a mark on the body in the form of biofield disruption, and biofield therapy can repair and help the immune system repair, the nervous system repair, and even the physical tissues to improve based on using biofield therapy to improve the communication within the body and remove blockage. And it really results in pretty immediate results of decreased pain and improved vitality. Many difficult life experiences, trauma play a role in our ability to heal or not heal. Difficult relationship breakups, divorces, victimization. Many of these types of traumas really do affect the body if it was not fully processed at the time. And so biofield therapy offers a unique way to neutralize the energy of these factors that is impacting the physical body, the physiology, and the neurochemistry without years of therapy. We can do this quickly and easily without reliving stress. All right, so in clinical, normally we have different ways of utilizing biofield therapy. Professional referral has been the most common way to deliver healing, having a session with a professional therapist. The pros are that it's very focused and customized to the patient's needs. The cons are that it requires a lot of commitment and cost from the patient. It is more costly, it is not covered by insurance, and it can be hard to find clinically focused practitioners who know how to apply biofield therapy to get clinically significant healing. Self-use tools are fairly available. We know of EFT, emotion code, meditation. There are lots of self-help tools. They are accessible. They are low cost. The con is that they're not always able to get clinically significant results. They're not usually health focused on disease. And it can be a little bit difficult to see blocks for the patient to know how to use those tools for themselves. Some are more accommodating than others, but then if they're more general, they can be less directed. So this is a con. And then patient commitment as well can be an issue if there's not accountability. Self-healing courses are another way to teach patients tools, to have a tool to use to empower someone through knowledge. The pro is its focus. They can obtain a life skill. It can really be customized. The con can be, again, the patient's ability to deliver this for themselves. It can require a little more investment on the patient's part, but it is probably lower than using private services. So this is also another option. What I am passionate about talking about is that there is another way that we can deliver biofield therapy through digital means. And these can be readily available self-help tools that are expert while being accessible. So definitely accessible and low cost. This is a way to receive healing that you don't have to create yourself. You don't have to learn how to do it yourself. You can just receive it through digital means. And not live, by the way. This is not virtual. We're talking about digital. And cons are that the patient has to be willing to help themselves. The other barrier is that this is innovative. It is a new technology, and so it's something that folks are not familiar with. So there are many different ways to integrate biofield therapy into medical treatment plans to boost patient outcomes. Definitely this in my own practice, we have used this in group and individual healing in my own business. We have equipped patients with at-home self-help tools they can use when they need it. And we have used this as a prescriptive tool, as an adjunct to other care. So when, especially for digital products, when a patient is not responding to treatment, in conjunction with their other therapies, this is something they can use to manage symptoms when they feel a need, when they are between sessions with their healthcare practitioner, when they have anxiety before a scan. Any of these times are a perfect time for a digital tool that can be used as a self-help. All right, so I really believe by working together, we can improve patient outcomes. We can integrate mind-body energy healing that makes a real difference for patients. And we need to come together to continue to innovate and build the knowledge and the availability of these tools, both for patients as well as for doctors and practitioners. Thank you very much.
Thank you for your contribution to our program. And I've just a little question. You mentioned that the practitioner in US, they don't have any idea about the mind-body procedures. And my question is whether it has been changing within the time during your practice, whether you see some progress in this case.
Yes, there is definitely awareness and knowledge so functional medicine is a very popular area of study for both people looking to be health coaches, for practitioners. Functional medicine and integrative medicine is growing tremendously in our country. So it's actually there is more and more awareness, and my goal is to equip doctors and patients with mind-body energy tools they can use that are clinically focused and that get results. So, acupuncture is actually becoming covered by insurance in the United States in some insurance plans. Chiropractic care can be covered by insurance in some medical plans. Integrative centers are popping up all over the country, especially in the Cleveland Clinic, where we have truly integrative care, where all sorts of mind, body, energy tools are used. So for clarity, definitely this is available, but you have to seek it out, and you won't find it if you go to your local community hospital, most likely. So I don't know what the percentage is of physicians and healthcare practitioners that are more holistic and where you can get holistic care, whole body care. But the awareness is increasing, and it's something that I think we have to keep building on. But there's tremendous opportunity and there's tremendous progress. So I think it's something to be very excited about, and something that we want to keep working toward.
Perfect. Thank you. Thank you to USA for your presentation and for sharing your ideas. Thank you and have a nice
Thank you.
day. Goodbye.